And I know we've talked a little bit about just maintenance stuff, injectables and things like that. What do you think?
Well, I believe I'm a big believer. I listen. I believe in surgery also. I believe in doing whatever is necessary.
Mm-hmm.
You know, the injectables, as we both know, can only take you so far, and then then you need work with a scalpel.
Mm-hmm.
But for me, at this point, I don't have the downtime for surgery, so I believe in injectables, and I'm actually really desperate right now for some, which is why I'm seeing you for real reasons.
You want to do some today, maybe?
Yeah,
Okay.
yeah.
Do some Botox, I think. The good thing about Botox, as you know, it takes like 30 seconds, so we can go ahead and do. A lot of people come in and say, can we do this filler today? Can we do this and that today? And I say, well, probably not, because there's a certain amount of time you need to do certain procedures. But Botox, honestly, is so quick and easy, as you know. It kicks in a few days, and you look better in a few days.
I find like
It's
Botox
awesome.
for me, I've only had it a couple of times. And I usually, I'm not the type, it's been so long, I'm not the over Botoxed look. I like to err slightly on I like to have some expression.
Yeah, yeah.
I want to be bigger than Mickey Mouse. And but I'm thinking, like, this around this area, the Botox, where is it placed? Like, around here?
Actually, if you do a little bit in the crow's feet area right
That's
here,
what I'm talking about.
you can also lift the brow a little bit at the same time.
How about I
which a
want
lot
to
of people
lift
want.
this up?
Yeah,
like this
we
a
can do
little.
that. I'll show you how to do that when we do the Botox.
That's really key.
And then most people want to do the forehead lines. That's another key area.
Well,
the frown lines is a key area.
I don't see a lot of that. See, I can ignore a lot when you wear bangs.
Yeah.
But I was putting on my eye makeup last night, and I was noticing that my brows were a little droopy, so I was thinking that would definitely clean up my eyelids.
Yeah, absolutely. Yeah, I mean, the things that people are doing injectable-wise, not that this all applies to you, but just kind of a rundown. We do the forehead quite commonly. We do the frown lines. We do the crow's feet.
Do I have frown lines?
Not many. No, I mean, they're a little bit, but not bad. We raise the brow a little bit, like we were just talking about. You can do underneath the eyes for the lines, just a little bit, because if you do too much underneath the eyes...
Wait a minute, where does that go?
Right
where
there.
do you put...
Yeah, right there. I know a lot of people do that, but it's actually the easiest area. You can barely feel it. And if you do it right there, you do too much. Now, if you do too much of anything, there's a problem. But if you do too much, the eyes can do that. So you got to be careful.
No.
Yeah. Then again, if you do too much up here, you can get droopy eyelids, of course, as well.
Oh, really?
Yeah.
I don't think I've ever done this area. I think I've only lifted the brow.
Yeah.
But I'm noticing that I do need to do this now.
I mean, most people over the age of, say, 35, I tell them, you might as well do all three areas.
Yeah.
I mean, it's kind of like painting that wall and not that wall.
Right.
That wall starts to stand out more.
It's like that, exactly. It's going to be like, why didn't you paint that part of the room?
Yeah, it stands. It's glaring at that point.
Yeah.
But the other areas you do Botox on, this is kind of rare, but some people have really big muscles right here. Right? These masseter muscles are called. We don't, but there are people that are really big and they don't like it. You do Botox, it shrinks the muscles down.
Oh, and then I've heard about something. What is it?
Yeah, the cords in the neck, these bands right here.
Where?
Those
Do I
bands,
have those?
You don't actually, no. But people who have that, you do Botox there. The corners of the mouth, I did it on a lady yesterday. If the corners of the mouth go down, you do some Botox in these muscles, and the corners go up a little bit. And of course, the other area...
That's when you're like this?
Yeah, and you don't need that either. And the other area that we do in people is the rabbit lines, right here. That's a very common area for Botox as well.
Wait, let me see that again.
Yep.
But I don't really care if I have a line when I make that face.
Yeah, you really don't. But it's some people have really deep lines when they do that.
Really?
But the Botox can be used so many areas.
But I want to ask something. Do people seriously walk around and worry about?
Some people.
Like if I'm making a snarling face, there's usually for a reason.
Right.
I don't really care if there's lines.
Well, you know what happens though? See, if you do Botox, say you do Botox in the frown area for several years, and so you're not.
Now
you're not
I'm going to be
squinting.
obsessed. Now I'm going to be like, once I do this area, tomorrow you're going to be getting that 9 o'clock in the morning phone call. I think I have rabbit lines now.
But see, Botox can shift other muscles to start working. So if you do Botox in the frown area, guess what you start doing? You can't frown anymore, right? Guess what you start doing?
What? Ah.
Then you develop rabbit lines, unfortunately.
Okay, so maybe I shouldn't do that.
So it's all the trade-off, I tell people. If you do the crow's feet a lot, you develop more lines underneath your eyes, potentially. Because if this part of the muscle can't work, then that muscle starts working, then you get more lines there. So it's just, nothing's perfect, and Botox is awesome, but it's a trade-off.
Now when I see people that look frozen, what is it that is done? Because not, as much as we all want to know what to do, because that's what we really want to know, as important is what do you not do to not get too frozen?
Yeah, and that's just, they put too much in. Now,
is it too much, or are they doing different air? I see some people who they just don't move.
Yeah,
really?
well, my nurse Lisa, who does my Botox, last week did Botox on my forehead and frown area.
And you can still move.
Plenty of movement.
Yeah,
and
that's
this
great.
is what I achieve when I do it on my patients, because my patients don't want that frozen look.
Right. So you know what I really wanted to ask you about is we've covered, okay, Botox. We're starting from the top. We're working our way down. We start the Botox. We'll do that, and then there's always the fillers that we can do to add. Like if you, I think what is it when you get older you lose volume.
Use volume,
So
yeah.
you
Yep. So we've
get
gone,
sunken.
yeah, we've gone from just filling in individual little things to volumizing the face. There's a term that a doctor came up with called liquid facelift, meaning that we're volumizing the face with all kinds of fillers, plumping up the cheeks and lifting things just with volumes. You're exactly right.
I agree, and
Yeah.
I also say that also has to be done with the right hand because I've seen some women look like jack-o'-lanterns.
Yeah,
at the
it's
end of
true.
it, you
Oh,
know?
yeah.
Like,
Yep.
it was
Yep.
like, okay, it's time to lay off the filler and go for the
Mm-hmm.
facelift. And that's where you have to really have an honest relationship with a surgeon.
You're exactly right.
Who will say to you,
Communication.
it's, okay, we filled it, we've done it, but we're
Yep.
at the point now where your head is getting to be as big as a pumpkin.
Yeah.
We can't do this anymore.
But here's part of the problem with that too, of course, is that there's some doctors, or many doctors, doing this type of thing who aren't surgeons. So even though it's time to go with a surgical option,
right.
the doctor's not a surgeon, so he's not going to say, "I think it's time to refer you to my surgical colleague." No, he's going to keep plumping up,
Right,
the face.
exactly.
That's part
You're
of
right.
it.
I didn't even think about
That's
that.
a lot of it, and of course we didn't discuss fat grafting yet. We've talked about Juvederm,
Tell me how you
Restylane, all these
feel
other
about
ones.
fat
I love
grafting.
fat. See, the thing about fat, meaning you harvest it
Right.
from the inner thighs, the abdomen, whatever.
So
Suction it out.
you can choose an area to harvest.
Yeah, yeah. Usually,
But is it painful or is it a big
Not
is it a
really.
big procedure?
It's like a mini version of liposuction. Suction it out, kind of cleanse it a little bit, put it in these syringes, and then you just essentially put a needle on the syringe and inject it into the eyes here, the nasojugal grooves it's called, and the cheeks and the lips and the folds. Same place we put Juvederm, Restylane, etc.
Why?
But yeah, the advantage of fat over those other ones is some of the fat can live. I always use the analogy of, say, you take a skin graft off the leg in a burn patient or something, right? Put it on the hand. I mean, it's living skin eventually. Like blood vessels grow into it and becomes living skin.
Right.
So it's the same thing with fat. You take fat out of the inner thigh, for example, you inject it in the cheeks. Well, over the next couple of days, little blood vessels grow into the fat, and it's living fat for the rest of your life.
I needed that
that's the beauty
explained.
of it. Yeah,
I couldn't
that.
understand why. What would be when there's so many options of fillers?
Yeah.
To why would you use fat?
That's why. And
So
you
so with filler that you will lose it after a certain time. What you're saying is with the fat you will keep some of it.
Some of it. The question is how much. For example, in smokers, their blood vessels aren't as healthy, and so those little blood vessels growing in to survive the fat aren't as strong, and so maybe more of the fat goes away in smokers. So it just depends on the person, but I think a certain amount of that fat's going to probably live in just about everyone. It's just a matter of is it that much fat, or that much fat.